Welcome to Health Simplified, where we break down some of those really complex health topics and make them well easier to understand. Today, we're taking a deep dive into the world of electrolytes. You know, those little charged particles that are absolutely essential for our bodies to function properly.
They really are. And it's amazing how often we kind of overlook them. Sodium, potassium, magnesium, calcium, phosphate. They're involved in so many things. Muscle function, nerve impulses, heart rhythm, fluid
Oh,
balance.
yeah. You can't forget fluid balance.
Right. And even slight imbalances can sometimes lead to pretty serious health problems.
So it's not just about athletes chugging sports drinks after a tough workout. These imbalances can affect anyone.
Absolutely. While athletes are definitely more susceptible to those noticeable shifts, anyone can experience electrolyte imbalances, especially people who are critically ill or dealing with certain medical conditions. You know, when your body is under stress from things like severe injuries, major surgeries, or even chronic illnesses, keeping that delicate balance of electrolytes becomes even more crucial.
That makes a lot of sense. I mean, our bodies are already working overtime to heal and recover in those situations. And any additional stress from electrolyte imbalances could make things a lot worse. But what's really caught my attention is this potential link between electrolytes and conditions that we don't typically associate with them, like eating disorders.
It's a fascinating area of research, and there have been studies showing a strong correlation between electrolyte abnormalities and a later diagnosis of eating disorders.
Really?
Yeah. What's even more striking is that these electrolyte problems often show up well before the actual eating disorder diagnosis, sometimes even a year or more in advance.
So it's almost like an early warning sign, a red flag that something might be off. That's incredible.
Mm.
But how does this work? Which electrolytes are usually troublemakers in these cases?
The most common culprit is lead potassium, also known as hypokalemia. And this often shows up in people who are later diagnosed with an eating disorder. But here's where it gets even more interesting. Other imbalances like low or high sodium hyponatremia or hypernatremia, low phosphate hyperphosphatemia, and a condition called metabolic alkalosis, those seem to be even stronger indicators of a potential eating disorder.
That's wild.
Rare.
So these electrolyte imbalances might be providing a glimpse into what's happening beneath the surface.
It really does seem that way.
Okay, so we've touched on the connection with eating disorders, but let's zoom out a bit and talk about how these imbalances actually happen. Let's start with trauma situations. I understand you have some insights from a study on young trauma patients.
Yes, this particular study looked at young adults aged 12 to 22 who had been admitted to the emergency department with multiple traumas.
That sounds pretty intense.
It was.
Hmm.
The most frequent issue they found was hypotension, low blood pressure, affecting over 62% of these patients. But right behind hypotension were electrolyte abnormalities, like high sodium or hypernatremia, affecting almost 10%, and low potassium or hypokalemia in nearly 7%.
So even in young people who've just experienced a traumatic event, electrolyte imbalances are a significant concern. What surprised you the most about the study's findings?
Well, they also found this strong link between needing referral to other wards in the hospital and certain abnormalities.
Like what?
Things like abnormal x-rays, high creatinine levels, which is a marker of kidney function, sodium imbalances, and issues found in urinalysis.
So even seemingly minor electrolyte disturbances in trauma patients could be an early indicator of more serious underlying problems.
That's exactly what it suggests.
It really underscores the importance of catching these imbalances early. But let's shift gears a bit and dive deeper into specific electrolytes, starting with potassium. It seems like potassium imbalances come up a lot, both in critical care and in the context of eating disorders. What makes potassium so crucial?
Well, potassium, it's crucial for so many bodily functions, especially muscle contractions, including your heartbeat.
Our heartbeat. Yeah, that's pretty important.
Right. Having too much potassium, known as hyperkalemia, can disrupt these processes and lead to some serious complications. On the other hand, too little potassium, or hypokalemia, can also cause problems like muscle weakness, fatigue, and even heart rhythm abnormalities.
Okay, so we've got hyperkalemia, too much potassium, and hypokalemia, too little potassium.
Right.
And both can cause serious problems. But how do these imbalances actually happen? Is it all about diet, like eating too many bananas for hyperkalemia or not enough for hypokalemia?
Diet does play a role, but it's often more complicated than that. Hyperkalemia can be caused by a bunch of different factors. Excessive intake through diet or supplements is one possibility, but it can also be caused by certain medications, like potassium-containing IV fluids or even some of those salt substitutes.
Salt substitutes, I wouldn't have thought of that.
You see, some of those substitutes, while aiming to reduce sodium intake, can actually be quite high in potassium, which can be problematic, especially for people with kidney issues.
That's really good to know. So what else besides diet and salt substitutes can contribute to high potassium?
Certain medications can interfere with how the body regulates potassium, for instance, penicillin G potassium, which is used to treat bacterial infections, or even packed red blood cell transfusions can contribute to hyperkalemia.
So even necessary medical treatments can sometimes lead to these imbalances.
Unfortunately, yes. And here's something you might not expect. Even genetic disorders can play a role. There's a rare condition called glomerulopathy with fibronectin deposits, or GFND, which affects the kidneys and can lead to high potassium
That's
levels.
amazing how our genes can directly influence our electrolyte balance. That's incredible.
Yeah.
But let's flip the script and talk about low potassium. What are some of the most common culprits there?
Low potassium or hypokalemia can be caused by several different things. It could be inadequate potassium intake, excessive potassium loss through urine or sweat, or shifts of potassium from the bloodstream into cells.
So a variety of factors can contribute to low potassium. What about medications? Do any medications contribute to this?
Yes, certain medications like diuretics, which are often prescribed for high blood pressure, can increase potassium loss through urine.
So the medication meant to help one condition could potentially trigger an electrolyte imbalance.
That's right, it's a delicate balancing act. And another common cause of low potassium is vomiting or diarrhea, which can lead to significant fluid and electrolyte loss.
That makes sense. And I imagine certain hormonal imbalances can also play a role.
You're absolutely right. Certain hormonal imbalances, like those involving aldosterone, which is a hormone that regulates potassium balance, can also contribute to hypokalemia.
Okay, so we've got a good handle on potassium now.
Hmm.
Let's move on to sodium, another electrolyte that seems to be frequently out of whack. What typically throws sodium levels off balance?
Sodium imbalances are often linked to fluid balance in the body. Hyponatremia or low sodium can occur when the body holds on to too much water relative to sodium.
So basically, sodium gets diluted.
Yeah, you could think of that way. This can be caused by several things: excessive water intake, certain medications, or even hormonal imbalances.
So drinking too much water can actually cause low sodium. That seems counterintuitive.
It can, especially if you're not replenishing electrolytes at the same time. On the flip side, hypernatremia or high sodium usually happens when the body loses more water than sodium. This is often due to excessive sweating, not drinking enough fluids, or certain medical conditions.
It seems like the kidneys play a really important role in regulating both sodium and potassium levels.
They absolutely do. The kidneys act as filters, helping to remove waste products and excess electrolytes from the bloodstream while reabsorbing what the body needs.
They're like the body's cleaning crew.
Exactly. And when the kidneys aren't functioning properly, it can disrupt that delicate balance of electrolytes.
So kidney problems can be a major contributor to electrolyte imbalances.
They can be a very significant factor, particularly in people with chronic kidney disease. Their kidneys may not be able to filter and regulate electrolytes as effectively as healthy kidneys, leading to imbalances like hyperkalemia or hyponatremia.
That makes a lot of sense. And it's a great segue into our next topic, how these electrolyte imbalances are diagnosed and treated. What's the first step in identifying an imbalance?
The first step is often a simple blood test to measure electrolyte levels.
So a blood test can tell us which electrolytes are out of balance and how severe the imbalance is.
That's right. Based on those results, doctors can then determine the best course of treatment.
So if someone is experiencing symptoms like muscle weakness, fatigue, or an irregular heartbeat, a blood test to check electrolyte levels would be a good starting point.
Definitely. Especially if there's any reason to suspect an electrolyte imbalance, like a recent illness changes in medication or any underlying health conditions.
Early detection and treatment are key.
Absolutely. Catching those imbalances early can prevent more serious complications down the line.
That's reassuring to know. But what about treatment? How are these imbalances typically addressed?
Well, it really depends on the specific electrolyte imbalance, how severe it is, and the underlying cause. In some cases, simple lifestyle changes might be enough.
So for mild cases, it might be as simple as drinking more water or cutting back on salty foods.
Sometimes, yes, but in other cases, medications might be necessary. For example, diuretics can help remove excess fluid and sodium in hyponatremia, while potassium-sparing diuretics can help prevent potassium loss in hypokalemia.
So the treatment needs to be tailored to the specific imbalance.
Precisely. What about more severe cases, especially those in critical care settings? What are the treatment options there?
That's a good question. What happens then?
In critical care, electrolyte imbalances often need more aggressive management. Things like intravenous fluids and electrolytes might be necessary to quickly correct severe imbalances, especially in situations like severe dehydration or after major surgery.
So it's about getting those electrolytes back in balance as quickly as possible?
Exactly. And medications to manage underlying conditions, such as kidney problems or hormonal imbalances, those also play a crucial role.
It sounds like treating electrolyte imbalances is often a multifaceted approach, addressing both the symptoms and the root cause.
That's a great way to put it. It's not just about fixing the numbers on a blood test. It's about understanding what's causing the imbalance in the first place and tailoring treatment accordingly.
This has been incredibly enlightening. I'm starting to see just how complex and interconnected this world of electrolytes really is, and how even seemingly minor imbalances can have a ripple effect on our health.
And we've only scratched the surface. There's still so much more to explore, like the role of other electrolytes like magnesium, calcium, and phosphate, and how these tiny particles can impact our overall health in really fascinating ways. But for now, let's take a quick break and come back to delve into those other electrolytes and discuss some practical tips for maintaining electrolyte balance.
All right, so we've tackled those big ones, potassium and sodium. But what about the rest of the electrolyte crew? Magnesium, calcium, phosphate. What are their roles, and what happens when they get out of whack?
Well, they're definitely important players too. They might not always be in the spotlight, but they're crucial for a whole bunch of bodily functions. Let's start with magnesium. It's involved in over 300 enzymatic reactions in the body.
Wow, 300. That's a lot. What does it do?
Well, everything from muscle and nerve function to blood sugar control and blood pressure regulation.
So it's kind of a big deal.
Oh, yeah, it really is. And low magnesium, or hypomagnesemia, it's actually more common than you might think, especially in folks with certain health conditions like diabetes, gastrointestinal disorders, or alcoholism.
And is it just those conditions, or can anything else cause low magnesium?
Oh, sure. It can also be a side effect of certain medications, too.
So it's something to keep in mind if you're taking certain medications.
Absolutely. Now, as far as symptoms go, they can be pretty subtle at first. Things like fatigue, muscle cramps, headaches.
Oh, those are never fun.
No, they're not. But if it's not addressed, it can get more serious. Seizures, irregular heart rhythms, even personality changes.
Wow. So it's not something to take lightly. What about high magnesium? Does that happen often?
High magnesium or hypermagnesemia, it's less common, but it can occur in people with kidney problems or those taking certain medications or supplements containing magnesium.
Okay, so it's not as common, but still something to be aware of.
Mm.
What are the symptoms of high magnesium?
Well, the symptoms often involve the nervous system. Things like muscle weakness, low blood pressure, nausea, and vomiting, even slowed breathing. And in severe cases, it can actually lead to cardiac arrest.
That sounds pretty serious.
Yeah.
So both low and high magnesium can have pretty significant consequences.
Mhm.
How do you treat low magnesium if someone is diagnosed with it?
Well, the treatment really depends on a couple of things, the severity of the deficiency and the underlying cause.
Right, so it's not a one-size-fits-all approach.
Exactly. In mild cases, just increasing dietary magnesium intake might do the trick. There are plenty of foods rich in magnesium.
Like what?
Things like leafy green vegetables, nuts, seeds, whole grains.
Okay, so those are good to incorporate into your diet.
Right. And then in more severe cases, magnesium supplements or even intravenous magnesium might be necessary.
Got it. So we've covered magnesium. Now what about calcium? I know it's important for strong bones, but what else does it do in the body?
Calcium is definitely crucial for bone health, but it's also involved in a bunch of other important functions like muscle contraction, nerve function, blood clotting, hormone regulation. Calcium levels are tightly regulated by the body.
How so?
Well, it involves this complex interplay of hormones, vitamin D, and the kidneys.
So it's not just about getting enough calcium in our diet, it's also about making sure our bodies can absorb and use it properly.
You got it. Vitamin D plays a key role in calcium absorption. And then the kidneys help regulate calcium levels by filtering excess calcium and reabsorbing what the body needs. When any of these components are out of whack, it can lead to calcium imbalances.
So there's a lot that goes into maintaining healthy calcium levels.
Mm.
What are some common causes of low calcium?
Well, low calcium or hypocalcemia can be caused by a few different things. Vitamin D deficiency is one. Also, hypoparathyroidism, which is a condition where the parathyroid glands don't produce enough parathyroid hormone, and that hormone helps regulate calcium levels.
Okay, so that can disrupt calcium balance.
Exactly. Kidney disease can also lead to low calcium, and certain medications can lower calcium levels as well.
And what about symptoms? Are there any telltale signs of low calcium?
Well, they can range from mild, like muscle cramps or tingling sensations, to more severe, like seizures, heart rhythm abnormalities, and even respiratory problems.
Wow. So it can really manifest in a variety of ways.
It can. And what about high calcium? What are the typical causes of that?
High calcium. What causes that?
Well, hypercalcemia is often caused by overactivity of the parathyroid glands, certain cancers, excessive vitamin D intake, or even prolonged immobilization.
Prolonged immobilization. How does that affect calcium levels?
When you're not moving around, your bones don't need as much calcium, so it can start to build up in the bloodstream.
That's interesting. And what about the symptoms of high calcium? What should people be aware of?
Symptoms of hypercalcemia can include things like fatigue, weakness, nausea, vomiting, constipation, confusion, and in severe cases, it can even lead to a coma.
So both low and high calcium can be pretty serious business, it sounds like it.
Yeah.
How are these imbalances typically treated?
Well, as with most electrolyte imbalances, the treatment really depends on the underlying cause and the severity of the imbalance.
Right. So there's no magic bullet.
Right. For hypocalcemia, calcium and vitamin D supplements are often prescribed.
Okay, that makes sense. What about hypercalcemia?
Well, treatment for that might involve medications to lower calcium levels, intravenous fluids to help flush out excess calcium, and addressing the underlying cause, like treating an overactive parathyroid gland or a calcium-producing tumor, if that's the issue.
So it's about targeting the root of the problem, not just the symptom itself.
Exactly. That's a really important point to remember.
This is all really helpful information. It's clear that calcium plays a pretty vital role in maintaining overall health. Okay, so we've covered magnesium and calcium. Now let's move on to the last electrolyte on our list, phosphate. What should we know about phosphate?
Well, phosphate, it's involved in a lot of essential processes like energy production, DNA and RNA synthesis, cell signaling, and maintaining acid-base balance in the body. Like calcium phosphate levels are also regulated by a complex interplay of hormones, vitamin D, and the kidneys.
So it's another one of those electrolytes that needs a lot of things to be working in harmony.
You got it. And when any of those regulatory mechanisms are disrupted, it can throw phosphate levels off balance.
What are some of the common causes of low phosphate?
Low phosphate or hypophosphatemia can be caused by a few things, like malnutrition, alcoholism, certain medications, vitamin D deficiency, hyperparathyroidism. It can also happen in people who are recovering from severe burns or who've been on ventilators for a long time.
Okay, so there are a few different scenarios that can lead to low phosphate. And what about the symptoms? Are they similar to the symptoms of other electrolyte imbalances?
Well, the symptoms of hypophosphatemia, they can actually be quite varied. They can range from fatigue, muscle weakness, and bone pain to more serious issues like confusion, seizures, and respiratory failure.
So it seems like a lot of these electrolyte imbalances share similar symptoms, which makes it even more important to get a proper diagnosis through blood tests. What about high phosphate? What causes that and what are the potential consequences?
High phosphate or hyperphosphatemia is often associated with kidney disease because healthy kidneys are responsible for filtering excess phosphate from the bloodstream.
So again, the kidneys play a crucial role.
They really do. It can also occur in people with hypoparathyroidism or those taking certain medications or supplements containing phosphate.
Okay, so a few different things can contribute to high phosphate. What about the symptoms and treatment of high phosphate?
Well, the symptoms. They can be subtle and often overlap with those of other conditions. Things like muscle cramps, itching bone, and joint pain, calcium deposits in soft tissues. And in severe cases, it can lead to heart problems or seizures.
So it can have a range of effects on the body. What about treatment?
Treatment typically involves addressing the underlying cause, like managing kidney disease or adjusting medications. And in some cases, medications called phosphate binders might be prescribed to reduce phosphate absorption from the gut.
So again, it's about taking a comprehensive approach and considering all the factors involved.
Exactly. And this really highlights a key point that we've touched on throughout our conversation, maintaining electrolyte balance. It's rarely a simple fix.
It's more about taking a holistic approach to your health.
Absolutely. Looking at diet, lifestyle medications, and any underlying health conditions, it all plays a role.
This has been such an eye-opening exploration of the world of electrolytes. It's amazing how these tiny minerals can have such a profound impact on our overall health.
And we've only just scratched the surface,
Yeah.
There's still so much more to learn about how these electrolytes interact with each other and how they influence everything from our energy levels to our mental well-being. It's fascinating stuff.
Well, I, for one, am eager to learn more about how we can keep those electrolytes in check and stay healthy.
Me too. And that's exactly what we'll be diving into next. So stay tuned, folks, because we're going to talk about specific strategies for incorporating electrolyte-rich foods into your diet, smart hydration tips, and even ways to monitor your electrolyte levels from the comfort of your own home.
Okay, so we've covered the what and the why of electrolytes. We know they're super important for our bodies to function properly, and we've talked about what can happen when they get out of balance. But now let's get down to the practical stuff. How can our listeners make sure they're getting enough of these essential minerals and keeping things in equilibrium?
Well, the great thing is a lot of it boils down to those good old-fashioned healthy habits. The stuff our parents and grandparents always told us about.
So we're talking about the basics of a healthy lifestyle, diet, exercise, hydration.
You got it. It all starts with what you're putting into your body. Focusing on whole, unprocessed foods is key. Think fruits, vegetables, lean proteins, whole grains.
So ditching the processed stuff and going back to nature's bounty.
Exactly. Those foods are naturally packed with electrolytes and all sorts of other good stuff your body needs.
And of course, we can't forget about hydration.
Absolutely. Staying properly hydrated is crucial. Aim for plenty of water throughout the day, especially if you're living in a hot climate or you're pretty active.
Speaking of active lifestyles, do athletes or people who work out regularly need to be extra careful about their electrolytes?
Absolutely. When you're sweating a lot, you're losing electrolytes. So replenishing them is super important.
So that's where those electrolyte drinks and snacks come in.
Exactly. They can be really helpful. But it's important to choose wisely. Look for options that aren't loaded with sugar.
Yeah, no one needs a sugar rush on top of their workout.
Right. It's all about finding that balance between getting the electrolytes you need and not overdoing it with the sugar.
And this might sound counterintuitive, but I've heard that even overhydrating with plain water can throw off electrolyte balance.
That's true. Drinking tons of water without also replenishing those electrolytes can dilute them in your system, and that can lead to hyponatremia, which is basically low sodium.
Wow. So even too much of a good thing can be a problem.
Exactly. Moderation is key, as with most things in life.
So we've talked about diet, hydration, and exercise. What about medications? We know that some medications like diuretics can impact electrolytes. What should people who are taking those types of medications be aware of?
The most important thing is to have an open dialogue with your doctor. Talk to them about any potential side effects, including the possibility of electrolyte imbalances. They can monitor your levels and adjust your medication or dosage if needed.
So good communication with your doctor is key.
Absolutely. And don't be afraid to advocate for yourself. If you're experiencing any unusual symptoms or have concerns about your medications, don't hesitate to bring them up.
Okay, so now let's talk about ways people can monitor their electrolyte levels at home. Are there any tools or tips you can recommend?
Well, while blood tests are still the most accurate way to measure your electrolyte levels, there are some at-home options that can give you a general idea.
Really? Like what?
Some smartwatches and fitness trackers now have features that estimate your sweat rate and electrolyte loss during exercise.
That's pretty cool. So technology can play a role in helping us stay on top of our electrolyte balance.
Definitely. And in terms of diet, there are plenty of delicious foods that can give you an electrolyte boost. For potassium, you can't go wrong with bananas, oranges, potatoes, tomatoes, and leafy green vegetables.
Okay, good to know. What about calcium?
For calcium, try dairy products, fortified plant-based milk alternatives, leafy greens, and almonds.
So load up on those fruits and veggies.
And don't forget magnesium. You can get that from nut seeds, leafy greens, avocados, and even dark chocolate.
Well, now you're talking my language.
Yeah.
Dark chocolate. Sign me up.
Right. It's all about incorporating a variety of foods into your diet. Aim for a rainbow of colors on your plate to make sure you're getting a wide range of nutrients, including those electrolytes.
This is all super helpful. I feel like I have a much better grasp on how to manage my electrolyte balance now. But before we wrap things up, I want to ask one more question. When should someone be concerned enough about their electrolytes to see a doctor?
That's a really important question. While mild electrolyte imbalances might not cause any noticeable symptoms, more severe imbalances can lead to some pretty serious problems.
Like what kind of problems?
Well, anything from muscle cramps and fatigue to an irregular heartbeat or even seizures.
So when should someone pick up the phone and call their doctor?
If you experience any persistent or worsening symptoms like muscle weakness, fatigue, confusion, nausea, vomiting, an irregular heartbeat, or seizures, it's definitely time to seek medical attention.
So it's always better to be safe than sorry.
Absolutely. Early detection and treatment can make a huge difference.
This has been such a fascinating and informative deep dive into the world of electrolytes. I really feel like I've learned a lot about how crucial they are for our overall health.
And I hope our listeners feel empowered to take charge of their own electrolyte balance and make informed choices about their health.
Exactly. It's all about taking a proactive approach and listening to our bodies.
Mm.
Thank you for taking the time out to listen to our deep dive. Until next time, stay healthy and stay informed.